Hi, I'm Talia.
I'm Brennan.
I'm Chloe. And I'm Brooke. And today we're going to talk a little bit about the prototype that we have come up with that is going to solve the challenge of increasing the accuracy and efficiency of communication between patients and the healthcare staff. Through this new call light system, we hope to better the experience for both the patients and the nurses. The target population that we've decided, it's really everybody who's in an inpatient facility. It's nurses, the patients themselves, and specifically patients whose first language is not English. This, just for a brief overview, this new call light system will have symbols including toileting icons, medication icons, question marks, etc. Talia and Brennan will talk a little bit more about that here soon. Basically, the goal is that the nurse will be notified of the specific request of the patient before coming into the room. So this will increase efficiency with the staff. They'll know what to bring into the room when the time comes. And we also have a interactive face of it where the patients can translate in real time. So that's kind of a background about our prototype and talking a little bit about our target population.
So, our prototype, we kind of drew a little drawing of what we had envisioned. So, as you can see at the top, there's a little emergency button, and then there's different icons. We were thinking about having both pictures and words to try to fit the best amount of patients possible. So a couple of the icons we were thinking about were bathroom, medications, questions. That way when they click one of these buttons, it's easy for them to identify what they need, and the nurses, as they're out on the unit busy with a lot of other patients and other things, they can see how quickly they need to come, if it's urgent, and they also know if it says, medication, that then they can go get the medicine so they don't have to go into the room and walk back. And so it kind of leads to a little bit more of an efficient communication between the patient and the nurse.
The second part of our call light system has a little screen, and then there'll be letters and words so the patient could type out exactly what they might need or they're thinking. And this can also help the nurse understand a patient who's nonverbal or help communicate their needs. And then we're thinking of putting a setting that could relate to patients who speak different languages. So they could type it out in their language, and then it would be translated into English or whatever language the nurse was speaking. This was just another added benefit that would allow patients to be able to better communicate with their healthcare team without having to bring translators in and out, and the patient is able to have a voice, speak, and advocate for themselves.
Yeah, and another part of that is we also thought in the typing area too that there would be a button that you could click speak, and that way the patient could just talk into it almost like Siri on a phone or something like that. So if there were, older people that couldn't type as well or something, they could speak into it and it could translate that way too.
So overall, this prototype that we had, we think that it would really help with our challenge that we identified in healthcare, because a major issue, especially with lower staffed units and not a lot of help, is that the nurses and the other staff, like the PCAs, feel like they are running all over the place trying to meet the needs of the patients, and sometimes there can be a miscommunication between what buttons really mean certain things and what is urgent and what isn't. And so having a prototype or having a call light like our prototype would be really helpful for these situations and reducing the amount of time that the nurses spend running back and forth for problems that may not be as urgent as they originally had thought. And like Brennan and Talia were mentioning about our prototype, having a setting on this as well that will help translate things can be really helpful for the patients who may not speak English as their first language, and a lot of time is also wasted with having to bring voices or translators, that type of system, into the room. So having something really convenient like this, almost like Google Translate on your phone, it would be really helpful to reduce time in that way as well, which ultimately is going to benefit both the patients and the nurses and the rest of the staff in the hospital.
Yep.
You guys have anything else to add?
I don't think so.
Thanks for watching.
Thank you.